GalVmed is the Global Alliance for Livestock Veterinary Medicines, catchy. We're full of acronyms, and you can see why, I'm sure. There's 700 million people in the world rely on livestock. Thank you. 700 million people in the world rely on livestock for livelihood, both in terms of daily needs, clothing, school fees, day-to-day healthcare, and also in the case of crisis or emergency as the only form of hard cash. And so this is really the only hard asset, livestock, chickens, goats, pigs, sheep, cows, for some 700 million people in the world. The lives of individuals, families, communities who rely on livestock. You can't hear me? Okay. Okay. I can't shout if it comes to it. That's better. There we go. Okay. So, recap. 700 million people in the world rely on livestock for livelihood. In times of crisis, people carry their livestock with them. This lady in the Democratic Republic of Congo displaced. So livestock's the only hard asset for very many people. And they are decimated by some very common livestock diseases of chickens, pigs, cows, goats, sheep, some of which we have the vaccines for in the affluent north, west, some of which we don't. Only 4% of international development aid went to agriculture in 2007, according to the World Bank, and within that we can strew a tiny fragment went to livestock because crops tend to get the lion's share. I'm furiously left clicking. So what is GalVmed? Well, we've been asked to speak because we're an alliance organisation. We have a diverse array of partners. We're a public-private partnership, and we try to take the best international research on vaccines for livestock from wherever that may be, with a preference for it coming from the developing world in terms of capacity building where that's possible. Our focus is on sustainability. It's a form of sustainable aid, helping the people through helping the livestock. And we're very well funded by the Bill and Melinda Gates Foundation and the UK Government's Department for International Development to the tune of $28 million over 3 years. What's our focus? It's about making livestock vaccines, medicines and diagnostics available, accessible and affordable to some of the poorest people in the world. Now, registration is a key concept to us of the pharmaceutical livestock product, so that it's governed by the rules of that particular country, and also importantly it can be commercialised. So you notice I've said affordable and commercialised, so we don't give the products away because we believe very much in value chains and sustainability. So vaccine dumping can lead, in our belief, to the destruction of the chain of the distributor, the vet, the small drugstore keeper, and the livestock keeper as a value chain. So we're very much about capacity building, and we're about, we don't manufacture the vaccines ourselves, we don't distribute them ourselves, we're a facilitating alliance. So wherever there's a weak link in the chain, whether it's on distribution or due to politics or whatever, that's where GalVmed, through its alliance partners, will try to facilitate. So anything from the actual physical existence of the product through research and development, right through to making sure that it's getting into the animal. It's a vaccine sitting on a shelf isn't going to have any effect at all. So some of our alliance members, the next slide please. So we constitute a very broad spectrum of organisations, as you can see, from big pharma, research institutions, governments of developing countries, to academic institutions. And with that reach, we're encouraged and not even slightly complacent to be working in 14 African countries now, in India and Nepal, with product development partners all over the world. Now, this approach is only really possible through the network and the strength and the scope and the reach that we've got by working with Pfizer, with Meriel, with SIVA, with universities and partners from the Southern Hemisphere. So all of this structure and network and so on always has to come back to the point, which is supporting the poor livestock keeper. They're part of our participative approach, they're part of our alliance, and we seek to hear them. And the great privilege of my particular job in communications, for me individually, is to get to spend time with Maasai, with backyard chicken keepers, and to listen to them. And I'm very conscious, only having been 3 years working in this field, addressing a group of people who may have worked in development for decades, as I often am when I'm speaking to veterinarians as well. But hopefully one of our roles is to be able to listen to the livestock keeper and to inculcate all of our practices and projects with what they're telling us. GovMed's had a business focus from the beginning, because we came about, started by accident, around the Dick Vet, around the University of Edinburgh, where academics, veterinarians, scientists and big pharmaceutical company people came together and identified a group of neglected diseases, or in fact the concept that there were neglected livestock diseases which it had not been worth the pharmaceutical industry's time or money to engage in. So we've had that kind of drive from business focus from the outset, both in terms of very experienced senior members of the pharmaceutical industry, sometimes near retirement, wanting to give something back, who sat on the board and have steered things as observers. So they identified this missing piece of neglected diseases and the worth of an organisation to act as a catalyst in trying to facilitate with the blockages which I referred to earlier. So how do we do business? Well, we're a sort of a cocktail organisation. We feel that we've got the ethics of a charity, that we've got the strategic and operational planning and focus of a business, and we've got the networking of, very importantly, a Southern Hemisphere-led public-private partnership. Because we were very keen not to be, I don't speak much Swahili at all, but another Mzungu led organisation, which is a white person. So it was very important to us to have senior leadership from the South, and GovMed has its African headquarters in Gaborone. We're now working in India and South America, and we can see ourselves moving to have even more of a leading presence in the Southern Hemisphere in the future. So what are our priority diseases? Just quickly to canter through, to give you a little flavour as the jigsaw assembles itself. This is just repetition and recall to see if you remember. So just to take a few examples, so East Coast fever is a tick-borne disease of cattle. It kills 1.1 million cattle a year in sub-Saharan Africa. A vaccine has existed in Nairobi for about 40 years, but wasn't registered and licensed to be used there. People were taking their cattle across the border to Tanzania, where through a sort of understanding between livestock keepers and the veterinary department, it was possible for vaccinations to take place. So GalvMed's role here has been to see the continuation of the production of the East Coast fever vaccine and to transfer it from ILRI, the International Livestock Research Institute in Nairobi, to Malawi, to the Centre for Ticks and Tick-Borne Diseases, because ILRI is a research lab and was never intended or never saw itself as being a vaccine manufacturer. Porcine cysticercosis is a major cause of epilepsy in the developing world, often going undiagnosed. Newcastle disease affects the poorest of the poor very often, chicken keepers, backyard chicken keepers, and it's a disease which can wipe out the entire flock of a village. And finally, Rift Valley fever, a zoonotic disease spreading from animals to humans. So one of the ways in which the business side of our global alliance has worked is through Pfizer Global Health Fellows, where we've had the loan for 6 months of Pfizer members of staff who've applied for this sabbatical, if you like, based in the developing world, lending their expertise, whatever that may have been, in the engineering of vaccines or in value chains or distribution chains. So that's a way in which not just the individuals of Big Pharma have been involved, but the kind of corporate structures as well. Partnerships currently at 128, legal agreements 82, and 45 other ones in preparation. And these are mostly to do with contracts for the delivery of service. But they're also about intellectual property, intellectual assets. And the important point for us here is that we don't keep the intellectual assets, we don't keep the IP. What we do is to try and ensure that they're protected with some of our commercial partners, so that through principles of global access, the poor livestock keeper does continue to benefit in the future. It all comes back to the livestock keeper, again trying to give them a voice, trying to listen to them. Thank you very much. Thanks for your attention.